Did you know that colorectal cancer is the second leading cause of cancer death in the United States? The good news is it's highly treatable when detected early, and today we have Dr. Ulrik Wallin, a colorectal surgeon with Optum Care Washington. Dr. Wallin has a bunch of good information about risk factors, warning signs, and prevention strategies. Thank you so much for being here.
Thanks you so much for having me.
Such an important topic, and so I want to get right to it. What is colorectal cancer?
Colorectal cancer is a cancer growth in the colon and rectum, and usually starts out with a small polyp and a precancerous polyps, and then it can develop into cancer.
Wow, okay. And what are some of the warning signs then too?
Well, unfortunately, it is in early stages, usually not any symptoms whatsoever.
Oh.
But as it grows, it can develop symptoms such as bleeding, abdominal pain, change in stool consistency, and sometimes also weight loss. So usually the later stages.
Okay, and how common is colorectal cancer too?
Well, it is the third most common cancer and the second most common cause of cancer death. So it is a very common cancer.
Yeah, is it starting like younger too, or is there an age range that people should be?
Well, it is more common in elderly.
Okay.
However, there are some indications that it's actually increasing in younger adults.
Wow, okay. And you touched on this, but who is at risk the most for colorectal cancer then? Elderly and then?
Well, elderly. So there are three main risk factors, and one is age.
Okay.
The other one is family history. And then there are also lifestyle factors. And we believe that diet, such as high red meat consumption, is a risk factor, but also increased alcohol consumption and smoking.
Oh gosh, okay, so things that we can be doing to lower our risk with some lifestyle changes.
True.
Okay, and what are some other things that people can do to make sure that we lower our risk?
Well, first of all, moderate or try not to have an excessive alcohol intake, stop smoking. And also, we believe that physical activity is protective, so a sedentary lifestyle is also been associated with a higher risk. The age we can't do that much about, and family history we can't do that much about either.
Yeah, and how about screening? Walk me through that.
So this is a very important thing, because screening is actually something we know can detect early stages, and it can remove precancerous polyps, and in that way we can reduce our risk to develop colorectal cancer. And as of today, we recommend starting screening if you don't have any other risk factors at age 45.
And what should you do if you do have some family history? Like, is there a certain age that you should come in potentially early for that, or walk me through that?
Yeah, so that is true. And I recommend that if you do have a family history, that you talk with a healthcare professional and ask if you need to start screening earlier.
Okay, and how important is it to catch colorectal cancer early?
It is very important. We know that the actual prognosis is going to be significantly affected if you detect it early. So early stages are associated with a better prognosis, whereas later stages, such as if it's spread to other organs, has much worse prognosis.
And I want to talk about that too. What should we know about colorectal cancer survival rates?
So the survival rates in early stages has improved, and it's somewhere around 80-90%. And when it becomes spread, it's down to 15-20%. And what we talk about is a 5-year survival rate.
Wow. What else do you think is just really important for people to know about screening and just colorectal cancer?
Well, first of all, screening with colonoscopy is very, very important. And I know this is something that doesn't sound pleasant, and
I feel like this is not something that people always want to run to do, but like you said, it's super important.
Yeah, and it is something that is very safe, and it is something that can actually prevent colorectal cancer. Me, myself, I had my first colonoscopy and I found 8 large polyps that were removed. So
wow.
I probably would have had colorectal cancer if I wouldn't have had my first colonoscopy.
And how often should you get a colonoscopy after you go in for that first initial screening if, you know, it's around 45 years old?
So it depends on. If you had a normal colonoscopy, the recommendation is 7 to 10 years. But if you had any polyps, then more frequent.
Okay, and so for you, would you recommend for yourself then with something like that? Would it be every year? Like,
it could be up to every year if you have
wow.
frequent polyps, or 3 to 5 years.
Okay.
Yeah.
Thank you so much for sharing
Yeah.
your story and all this information.
Yeah,
We
you're
really
welcome.
appreciate it.
Thanks for having me.
Yes,
Yeah.
and to learn more about Optum Care Washington, just visit the website that you see right there on your screen.
This portion of New Day Northwest is sponsored by Optum Care Washington.